Today we're going to be talking about fungus. I know it sounds kind of funky, but we have a solution. And with us now is Yvette. Welcome to the show. How are you?
Hi, thank you for having me. I'm great.
I learned a lot just in the little visit that we were having. So you're an anesthesiologist, and you're in Maryland, but you're someone that grew up with a skin condition that a lot of people don't really know what it is or how to treat it. But you took some time away from your busy job to figure it out. Okay, so you started a company called Complexion Rescue. What type of fungus are we talking about? What is it that you have that you found a solution for?
Right, so the fungus, it's actually a yeast, it's called Malassezia. It actually lives on all of our skin, and it's mostly harmless. However, for people who have oily skin, it feeds the fungus and the fungus overgrows. Once it overgrows, then it becomes unbalanced on the skin, and then it becomes quote unquote harmful to the skin, and it creates these conditions.
So it's different than a yeast infection for female or even male. Sometimes you get yeast infection. It's a different type of yeast, right?
Correct.
But it feeds off of oil.
It feeds off of oil. It cannot make its own oil, and so it looks for sources of oil either from our own skin or for the products that we use.
Interesting. So like a tick that drinks blood, right? This particular fungus drinks the oil.
Correct.
Okay. How did you figure out a way to lessen the symptoms of what that fungus can do?
So it took a little bit of research and literature search and trial and error, actually, and to figure out which oils and what products have those oils, and also how to control my own oil production in order to get the thing under control.
So you were young and you had acne, and so you were doing like topical creams and things like that because you just thought it was traditional acne.
Yes.
What test or how did you self-diagnose that made you realize that maybe it was different than others?
Just trial and error with how products were affecting my skin, and just some literature search for images of people that looked like me and had those same lesions that I had.
Okay, so are they like little pus pockets? Are they different from your face to your chest to your back? Like, do they appear differently, or are they always kind of a similar look?
Right, so the Malassezia can take on different forms depending on each individual.
Okay.
3 major forms that it takes on. Actually, there are 4, one of which is dandruff. Most of us are familiar with that. That affects the scalp. It's flaky and itchy. But for the skin, it can have 3 forms. It can have tiny little bumps that look like whiteheads. For some people, they're itchy. For most people, they're not itchy. It can also, itself, once it overgrows, form colonies that become visible to the naked eye, and that looks like hyperpigmentation.
Really?
So that's often misdiagnosed as a disorder of the melanocytes, but it's actually the fungus colonies that are appearing hyperpigmented.
My
And
goodness.
the third way that it can affect you is that once the colonies form, they give off azelaic acid, which also lightens the skin. And so that combination can create hyperpigmentation, hypopigmentation, overall uneven skin tone.
My goodness. So you just like, as if being an anesthesiologist for you just wasn't enough. I understand that sometimes when we are challenged with something and we want to just research because we know there's going to be an answer, that's what you did. What has the response been from people that are triggered by that type of skin disorder and you're able to help them?
Yeah, it's amazing. Some people are surprised at how quickly their skin turns around. So I have a friend who has a 6-year-old son, and so it affects people of all ages. And the 6-year-old son of hers had what is called tinea versicolor. It's just a medical term for tinea, which is like fungus name, and versicolor meaning multiple colors on the skin. He actually had hypopigmentation, and it's aggravated by sweat and oil and sun, and he's outside a lot playing. And he tried the product, and he had tried many other things without relief. And within a week of using that, his skin was completely clear.
My goodness.
Yeah.
Which is wonderful for him, especially when you're young and, you know, children sometimes can be cruel. Adults can be cruel too.
For sure.
But when you're living with something like that and your appearance is important, you know.
Absolutely.
It's nice that these are effective. So tell us what your product line is. What do you have?
So what I have is a complete product line. What I discovered during my literature search, there is a site that I use that vets the ingredients of all of the products to determine whether or not they aggravate the Malassezia, meaning whether or not they have ingredients that supply the oils, the fatty acid and esters that make the Malassezia grow.
Okay.
So plugging all of those ingredients in, I came up with products that I could use and some products that I couldn't use. And what I discovered is there's no one skincare line that has a complete fungal acne safe line. So you can use some products from one company, some products from another company. That's very frustrating. It's also frustrating to stand in the cosmetic store and plug in ingredients into a website to see if you can purchase that product. So I decided to create a one-stop shop so that you can have everything from skincare that would be fungal acne safe.
And if you just have acne, but it's not fungal acne, do these products also help that at all, or no? Is it
It's
only
specific
for the
for
fungus?
Malassezia.
Okay.
The other forms of acne,
Malassezia.
Malassezia.
I'm saying it better now, right?
Yeah, correct. The other forms of acne are caused by bacteria, so this is
Okay.
not antibacterial.
Oh,
this
bacterial.
is antifungal.
Okay. Which is almost kind of like pneumonia. You know, there's different types of pneumonia.
That's
There's
right.
different types of everything. One's
Exactly.
bacterial, one's fungal, and you're like, what?
That's
Which one do I
exactly right.
have? How do you know?
And interestingly enough, products that are formulated to treat antibacterial can aggravate the fungus.
So it's important to know which
So
one
it's
you
important to know which one you have.
have. Amazing. Absolutely amazing. So it's created in Maryland also? Is that where you're creating some
it's
of the
formulated
products, or
in Indiana.
formula?
I have a partnership with a company in Indiana.
Lovely.
But yes, I've formulated it and tested it personally.
Congratulations.
Thank you.
Yvette, it's so nice to meet you. It's nice to have someone like you that has a personal story behind their brand, right? Like you are the reason. You're like, I'm going to figure this out and I'm going to figure out a solution, and you did. And these products, is it like one-time topical, or how do you use them?
So the cleanser you would use daily.
Okay.
And it's gentle enough to use every day. The toner helps remove the deep oil in your skin. That's the oil that's left behind that you don't see with the naked eye, but the fungus is still eating it and still growing. And then I have some other products here, like this healing serum. So it contains products that help control the fungus itself, not just the oil. And then a moisturizer, because most of us with oily skin are the people that suffer from this. And most people with oily skin do not think they need a moisturizer. But we all do need moisturizer, and without using moisturizer, then your skin produces more oil. So it's very important to use a moisturizer, but a specific moisturizer that doesn't contain products that will aggravate the fungus.
And feed the fungus. So we're just like not feeding the fungus.
We're
is
not.
what
We're going to starve the fungus until it behaves.
love
It doesn't go away because it's on all of our skin, but we can control how it grows and what form it presents in.
Complexion Rescue.
Correct.
Thank you so much.
Thank you for having me.
I'm always learning new things when I have guests on the show. I hope that you learn something new, but more importantly, if this is a solution that you need, check it out. Thanks for watching.